This is Steve Adubato. It's my honor to welcome for the first time with us talking about an incredibly important health-related topic. Dr. Laurie Jacobs is chair and professor, Department of Internal Medicine at Hackensack Meridian School of Medicine and Hackensack University Medical Center. HMH is one of the major healthcare systems supporting what we do. Dr. Jacobs, long haulers, I've been hearing it more and more. My younger sister, Michelle, will not be upset me disclosing this. I have the okay. She's a long hauler. She had COVID early on. She's still dealing with it. For those who have tested positive and been treated for COVID, what is a long hauler and why does it matter so much?
So most of us define people with chronic COVID as greater than 3 months. A lot of people have a COVID-19 infection and recover immediately within a few weeks, maybe have lingering symptoms 6 weeks to 3 months. But after 3 months, we grow concerned that they have a more chronic syndrome that we're seeing more and more often. We've been running our post-acute COVID recovery center at Hackensack Meridian Health now since July, and we had our outbreak starting in March. We're seeing patients with symptoms 8 and 9 months in duration.
By the way, we're taping on December the 8th. We're in the middle of this, quote, second wave. I'm not sure which way we're supposed to call it, but I'm going to go through this. Help us on this, Dr. Jacobs. Some of the long-term complications from COVID-19. Difficulty breathing, speaking, or swallowing. Difficulty walking or performing self-tasks. Feeling of extreme fatigue, tiredness. Cognitive changes, such as problems thinking and concentrating. Mental health concerns, anxiety, depression. That's serious stuff.
It is serious stuff. And unfortunately, for a lot of individuals, no one has taken them seriously up till now. But now there's been more media attention and it's being recognized that this is a real syndrome. We don't entirely understand it yet, but it is probably a generalized response to the infection with various manifestations that you described, the most common being extreme fatigue, so tired you can't get up and go about doing your daily activities, and it kind of waxes and wanes. It can go for a few days, and then suddenly you have a day you feel great, and you think you're on your way to getting better, and whammo, the next day or that evening, that terrible fatigue returns. There are a bunch of people who have with that this cognitive issue called COVID fog in the public speak. And this is a sense of not being sharp, not being on your game, having difficulty, thinking through issues, knowing what's going on, may impair your ability to manage your work or your finances. So it's very real. Then there are people with shortness of breath, cough, chest pain, who may have cardiac or pulmonary manifestations. We saw these after the SARS outbreak many years ago. Most of those patients recovered pretty much at a year, but they still complained of shortness of breath, even though on measurements they seem to have recovered. We don't know what will happen with those who had been infected with COVID-19 and still have these symptoms. And this whole syndrome occurs probably in a minority of patients, maybe 2%. Maybe 2%, maybe more. We don't actually know that yet. The NIH has just convened a conference to determine the scientific underpinnings and the prevalence. So no one really knows. But even if it's 2%, that's 2% of millions of people worldwide who've been infected. So that's a lot of people.
Let me try this. You're part of the COVID Recovery Center. As part of the COVID Recovery Center, the COVID Rehabilitation Program at JFK. JFK is one of the hospitals within the HMH system. I'm not mistaken. They have a rehabilitation institute. So the reason why I'm mentioning that, and I know JFK well, is that there are programs, there are initiatives as these folks who are dealing with the long-term implications of COVID, there are places for them to go, correct?
Yes, so we've set up a multi-pronged program. There's a general intake number, 833-565-0405, and we evaluate.
Do it again, doctor? Do it again.
833-565-0405.
And what's that for?
That's a general intake number where one of our providers will do a telehealth visit usually and try to help someone figure out what are their symptoms, how impaired are they, and what are their needs. And then we have a variety of settings and interventions that we're offering. So they can see a primary care provider. They can see behavioral health and have telemedicine for anxiety, depression. There's a tremendous psychological burden associated with just feeling fatigued and ill, in addition to all that's gone on with COVID. In addition, we have groups of pulmonologists, cardiologists, neurologists who are working with us. And then the rehabilitation programs, both outpatient and inpatient rehabilitation. And some of the treatment is rehabilitation. For example, patients with a cardiac syndrome that we've seen, it's similar to something called
patients with COVID. I'm sorry for interrupting. Patient with COVID had cardiac issues?
They can have cardiac issues, but we don't know the extent of it or how long it will last. There are some studies that show that they had inflammation of the heart muscle or the lining of the outside of the heart a couple of months afterward, but that may resolve, we don't know. But then there are individuals who have palpitations and lightheadedness so bad that they have to lie down, they can't do their activities. And some of those patients are treated with rehabilitation as well as cardiac interventions.
Dr. Jacobs, I'm sorry for interrupting. Before I let you go, the quick thing I want to ask you, because we are committed at the Caucus Educational Corporation in cooperation with our brothers and sisters in public broadcasting to be engaged in the most effective public awareness, public education around the vaccine. Now we're taping on the COVID vaccine. Now we're taping at the end of 2020. It'll be seen in 2021. What's the message you have for those out there who are skeptical? Some have legitimate questions about it. What would you say?
I think this is a very serious disease. Even if you had a mild case, you could have severe post-COVID syndromes. The best thing is to prevent getting this disease. Vaccines have been the way that we have prevented disease for decades in the world and has prevented more disease than medical treatments. This is a very serious disease, and prevention is our best way out of this.
Are you going to take it? Are you going to take it?
Absolutely.
Would you do it publicly, doctor? Would you do it publicly to send a public message?
Absolutely. I think it's critical.
It's interesting. We're going to be talking to, we actually talked to Dr. Sharif Al-Nahal over at University Hospital, who told us that a significant percentage of their clinicians are skeptical. It seems to me that the public awareness campaign, I'll get off my soapbox right after this, is not only with the general public, but with clinicians, because people are going to watch what you and your colleagues do. And Dr. Laurie Jacobs, the chair, professor, Department of Internal Medicine at Hackensack Meridian School of Medicine and Hackensack University Medical Center. I want to thank you so much for joining us. We appreciate it. All the best.
Thank you, Steve. Appreciate it.
I'm Steve Adubato. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the New Jersey Education Association, the Russell Berry Foundation, New Jersey Sharing Network, MD Advantage Insurance Company, the New Jersey Economic Development Authority, Operating Engineers, Local 825, New Jersey Board of Public Utilities, Clean Energy Program, the Northward Center, and by the Adler Aphasia Center. Promotional support provided by Meadowlands Chamber and by Insider NJ.
I could feel my lungs fill with oxygen, and I got my life back.
The Sharing Network means to me hope, life, and everything.
The Sharing Network was a lifeline to me when I really needed it.
We are an organ procurement organization.
The core purpose of the New Jersey Sharing Network is to save and enhance lives.
To honor those who gave.
Pay tribute to those who received.
Offer hope to those who continue to wait.
And remember the lives lost while waiting.
For the gift of life.